And now to the UK, where Prime Minister Rishi Sunak is struggling. He took office in exceptional times, the third Prime Minister in 2 months, the fifth in 6 years. He promised to fix the economy. He had experience, after all, as Chancellor of the Exchequer, or the UK's version of a finance minister. So this millionaire Prime Minister took office with a 5-point agenda. He promised to halve inflation, to grow the economy, reduce national debt, reduce wait times at the NHS, and stop the small boats. Basically, fiscal prudence with a dash of populism and a heavy dose of xenophobia. That's what he promised. But this agenda is falling by the wayside, so much so that he doesn't call these 5 points his 5 promises anymore. He now refers to them as 5 priorities. Similar but not quite the same. And he has reason to change his words. His agenda seems to be unravelling. We'll start with Britain's National Health Service, or NHS. It is slowly collapsing. Last Friday, it got a shot in the arm. At least that's how the UK government sold it. Prime Minister Sunak made this announcement.
We're announcing the most ambitious transformation in the way that we staff the NHS in its history, the long-term workforce plan. This is a 15-year plan to deliver the biggest ever expansion in the number of doctors and nurses that we train, and a plan to reform the NHS so we deliver better care in a changing world.
Quite the announcement. It came just days before the NHS celebrates its 75th anniversary. The Sunak government released a 151-page plan. It was to address the crisis plaguing the NHS. And what does it say? They'll increase the number of seats in medical colleges, reduce the course duration from 5 to 4 years. It may help, but it won't help immediately. The healthcare system in the UK is in crisis. They have a workforce crunch and a high rate of attrition. People are leaving their jobs. Does Rishi Sunak's plan address that? It offers flexible working, better workplace environment, and improved training opportunities, apparently. But do you know what's missing? Better pay. It's not mentioned in the list. And that's the reason why so many Britons are striking and quitting the healthcare industry. They want better pay. To be fair, Sunak has pledged more money, an additional £2.4 billion, that's about $3 billion to the NHS. And this will be over the next 5 years. And the long-term plan runs through 15 years. You know what that means. Future budget allocations will be the next government's problem, most likely not Sunak's government. So the plan is far from perfect. It's being cautiously welcomed because this is the first substantial plan in years. So you could say something is better than nothing. It may or may not save the NHS, but it's highly unlikely to save Sunak's job. Because look at how he's floundering. Inflation isn't close to getting halved in the UK. Economic growth is still projected at 0.1%. That's close to nothing. And the UK's debt is the worst in 60 years. The numbers came out last week. Debt has passed 100% of the GDP for the first time in 6 decades. So fiscal prudence is a complete failure. And then there's the issue of small boats. Sunak wants to deport asylum seekers coming to the UK by boat. His government wants to send them to Rwanda, and that too at great public expense. Now, this scheme has been championed by Suella Braverman, herself a daughter of immigrants. Now, this grand plan has hit a wall. The British courts. Listen to this.
The deficiencies in the asylum system in Rwanda are such that there are substantial grounds for believing that there is a real risk that persons sent to Rwanda will be returned to their home countries where they faced persecution or other inhumane treatment when, in fact, they have a good claim for asylum. In that sense, Rwanda is not a safe third country. In consequence, sending anyone to Rwanda would constitute a breach of Article 3 of the European Convention on Human Rights, which Parliament has required the government to comply with.
So the Rwanda deportation drive is also a non-starter. Sunak's government is going to appeal the ruling. It will try and convince the courts that permanently sending people to Rwanda is perfectly safe, even though experts say it will have no impact on the small boats problem. And polls say that a majority of Britons are against this policy. It's proving to be too expensive, both financially and politically, but they want to stick to it. And guess what else Sunak is turning to? Racism. He says he felt the sting of racism while growing up in the UK. Good pitch, but unlikely to win him the next election.